I have been engaging with the Minister and her department over a period of time to organise this visit to make sure the health service in Clare is a priority, especially for the people living in Clare. A programme for this visit is currently being finalised with a focus on giving the Minister an overview of healthcare delivery across the county, including rural areas, which you mentioned is very important. There is meetings organised with the management of Ennis General Hospital, local councillors, and the Friends of Ennis Hospital, who are doing a fabulous job in trying to promote and keeping services in the hospital.
Do you think that the Minister doesn't currently have a grasp on the healthcare situation in Clare?
Yes, Seán. I am bringing the Minister to the county to make sure we have proper health services. And I also want her to visit both West and North Clare to experience the reality facing people and patients in those areas. And Seán, it is important the Minister sees the reality of living in Clare, particularly in the West and North Clare, where distance and access is a real issue, as both you and me are well aware of. I will bring her through those areas so she can see firsthand the long journeys people have to make to access hospital care. And you only get a proper sense, my belief is, when you travel these parts of the country yourself and you see really what the people of those areas are up against.
What do you want to see come out of this visit, Joe, in terms of actual results?
We want to see proper services there for the people of our county, both hospital services and ambulance services. And we're all well aware at the moment the services are not at the pace they should be.
And when you say proper services, do you have anything in mind? Say, for example, for Ennis Hospital, are there particular advancements you want to see?
The Minister herself is going to chat with the management of Ennis General Hospital and see what can be done to improve the services that's there. We have to give credit to the staff of Ennis General Hospital who are doing fantastic work. But again, there's other services I believe and she believes they can take place in Ennis General Hospital, and that's something she's going to be chatting with the management of the hospital to see can that be achieved going forward.
You'll be aware, Joe, that the Minister described the Raheen site that was announced a number of months ago as option B and C+, referring to HICWA's recommendations. Is the case for a new emergency department in Clare dead in the water?
We have to listen to what the Minister's to say. She's coming on Monday, as you rightly said. She's going to meet the different groupings. There will be questions put to the Minister. I'll be pushing hard to make sure there's proper services in our county for the people of County Clare, and we'll have to see what response we get from the Minister on Monday. It's important and vital she come and listen to the concerns of these organisations in the county, and after that we'll see where we need to go and what we need to do to make sure that there's proper services in the county for the people of Clare.